Together we achieve victory over heart failure.
Hello, I am Dr. Awadhesh Kumar Sharma, Professor of Cardiology at LPS Institute of Cardiology, GSBM Medical College, Kanpur. Here today, we are delving into a silent epidemic that India is combating, known as heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike the Western countries, where heart failure is predominantly a disease of elderly. Now let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? Dear, when people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently it should. The ejection fraction, or commonly known as EF, measures how well your heart pumps blood. It's the amount of blood pumped out of your heart's lower chambers, that is ventricles, each time it contracts. While a normal ejection fraction is around 50 to 70%, individuals with heart failure typically have an ejection fraction of 30% or lower. Genetics plays a significant role. Indians are genetically more vulnerable to cardiovascular diseases, and furthermore, hypertension, diabetes, obesity, and smoking habits worsen this epidemic of heart failure. Watch out for confusion, fatigue, heart palpitation, nausea, shortness of breath, and weakness. There is also loss of appetite or vomiting. So, if you see any of these symptoms in any patient, then you must suspect diagnosis of heart failure and you must consult your cardiologist or physicians nearby. So now the question arises, how can we protect ourselves from this dreaded disease? Our hearts work incredibly hard to keep us alive. These are 5 golden rules we can follow to return the favor. Number 1, early detection of heart failure through regular blood tests. Number 2, dietary adjustment to maintain heart health. Number 3, incorporating daily exercise into your routine, at least 30 minutes a day for 5 days in a week. And number 4, practicing stress management techniques. And number 5, quitting alcohol, tobacco, and smoking. Now, lastly, what comes next after a heart failure diagnosis, or what comes in the mind of a patient? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improves quality of life and longevity. Devices like biventricular pacemakers, implantable cardioverter defibrillators, and heart wall repair or replacement. And the last resort treatment option is no doubt heart transplant. The lifetime risk for congestive heart failure or heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.